So we can go ahead and get started. So this event is being recorded. So for anyone who's watching and recording, thank you for tuning in. My name is Tom. I work in the admissions office. I'll be hosting the event tonight. But before we go any further, if some of our esteemed colleagues wouldn't mind just introducing themselves quickly here before we get started. Lori.
Oh, my name is Lori Park. I am a family nurse practitioner working here in the with the graduate faculty. I have been working here as full-time faculty. I'm ending up my second year, I guess. I worked as adjunct faculty before that, and I have my doctorate degree. And I guess that's it.
All right, thank you, Lori. And Dr. Schaefer.
Hi, my name is Dr. Schaefer. I'm also a family nurse practitioner. My practice in a primary care setting, as well as a full-time faculty member in the graduate nursing program. So welcome. Thanks for watching.
Yes. Yep. Thank you, Dr. Schaefer. And Dr. Olszewski.
Hi, everybody. I am the Briner Family Endowed Professorship of Nursing. I work in graduate nursing for the last 10 years. I'm currently the graduate chair, as well as director of the NP and DNP programs. I'm an alum of our nurse practitioner program from, I'm going to date myself when I say 2000, but it's been a while. I'm an adult nurse practitioner, and my background's in occupational medicine. So thank you for joining us.
Great, thank you. And Dr. Barrett.
Hi, everyone. My name is Melinda Barrett. I teach in the public health nursing program, both at the undergraduate level and moving into primarily graduate level here now, managing the public health in nursing master's program. So my background is in public and community health, lots of time spent in several different settings in home health and school health. So have a doctorate degree from IUP, a state university as well. And I am also an alum of the Masters in Community Health at the time here at Bloomsburg in 2008. I'll date myself going back then. So very proud to be part of this program, and welcome.
All right, great. Thank you, Dr. Barrett. Dr. Manzola.
Hi, everyone. I'm Dr. Manzola. I'm the program director for the Geisinger Bloomsburg Nurse Anesthesia program since 2016. I've been with the program since 11, as I'm thinking back, 2011, and happy to be here. I'm also an alum from Bloomsburg University. We got my undergrad there in 94. My gosh, I really dated myself, and I just finished my MBA last year from Bloom University. So welcome. Thanks for coming.
Excellent. Yes, thank you, Dr. Manzola. Dr. Ambrose.
Hi, and welcome. I'm Ted Ambrose. I'm the assistant program director of the nurse anesthesia program here for Geisinger and Bloomsburg. I am a Bloom alum. I'm a 2013 alum of the nurse anesthesia program. I've been in some capacity with the university since 2013, since I graduated. I'm a staff anesthetist at Geisinger.
Great, thank you. Dr. Jackson. Oh, yeah, you're muted.
You'd think after all this time I'd be used to it. Anyway, I'm Cheryl Jackson, and it is not a requirement to be a Bloomsburg alum to be employed there. So I did not go to Bloomsburg. I'm a family nurse practitioner. My practice area currently is with uninsured patients. And I like diverse populations, and disparities in healthcare is my real interest there. But I teach in the graduate department in the pharmacology, my very favorite course, and diagnosis and management.
Great, thank you, Dr. Jackson. And last but certainly not least, Dr. Metzger.
Thank you. Hi, I'm Lori Metzger. I am in the club. I am an alum. I have my adult nurse practitioner from Bloomsburg University. But I direct the Masters of Science in Nursing Administration with an MBA option, dual degree program. And so that's the program that I'm responsible for. I've been at Bloomsburg University teaching now for about 16 years, actually in the fall, start my 17th year, which is hard to imagine. And so I'm happy to be with all of you here tonight. Thank you.
Excellent. Thank you so much. And again, this event is being recorded. It should take probably around 30 or 40 minutes. If anybody has any questions, please feel, or if you wouldn't mind holding them until the end, we'd be happy to address the whole group here. And with that being said, I will go ahead and get started here. Let me just share my screen. And again, welcome everybody. Thank you so much for joining us. All right, so I realized I got ahead of myself a little bit, and we already met the faculty. And you'll notice that it's a pretty large team, and part of that is because we have a wide variety of programs to provide. It's not just the MSN, it's just not one of the concentrations, just not the DNP program. There is a broad array of programs to meet any of the needs of our prospective audience members. Dr. Olszewski, would you be able to talk a little more about some of the programs here that you would find in the nursing programs?
Absolutely. Our graduate nursing programs have been around just over 30 years now. Our undergraduate about 40 plus years. So we have a long history, certainly, of providing good quality nursing education in Central and really all over Pennsylvania. We have graduate students coming as far away from Philadelphia, and our anesthesia program coming even from out of state. We have 5 graduate nursing programs, and you're going to be hearing about all of those tonight. And we also have a doctoral program too we're going to talk about. The nurse practitioner program, you heard many of us are alums of those particular programs. They have been here at Bloomsburg for about 31 years now. We have adult gerontology nurse practitioner program with the emphasis on primary care. So not acute care, but rather primary care. And we have the family nurse practitioner program, which the difference between the two is really population. If you have a desire to treat pediatric patients, the family nurse practitioner includes pediatric patients. Adult gerontology starts at about age 12. We have the public health program. The public health program is completely online, and they have a focus on school health nursing as well. You'll be hearing a little bit more about that. Public health has been really come to the forefront this past few years with COVID. And there's a real kind of distinct population that this group has. And Melinda, Dr. Barrett will be telling you a little more about that. MSN MBA is another completely 100% online program. It's a dual degree option, and we work closely, obviously, with the College of Business for that. The RN to BSN to MSN track, we have a lot of students that show interest in joining us to get their baccalaureate and find that the MSN is a career path that they want to go on. Our program is unique in that we are able to use 3 of the courses that are 500 level courses for the graduate portion of that degree towards the BSN. So essentially 9 credits are used to kind of fulfill the BSN requirement while you're on your way to achieving your goal of an MSN. So we do have that option that it transitions from RN to BSN to MSN. We have the BSN to DNP nursing anesthesia program, and that just switched. This is the first cohort this year that will be on track to completing their terminal degree at the completion of the program. That is a requirement of the COA, which is the accrediting body. And Dr. Manzola and Dr. Ambrose will tell you a little bit more about that here in a couple slides. And then finally, we have the postmaster's DNP. And the DNP is the terminal degree, terminal practice degree that many nurse practitioners, nurse anesthesia, nurse midwives, and we had some CNSs, clinical nurse specialists, that want to come back and get a terminal degree in something other than research. And the postmaster's DNP is a great option for getting that terminal degree, and we'll share more about that as well. So the next few slides, we're going to take you a little bit deeper dive into the graduate programs, and each of the program directors will give you highlights of that program, and then we're going to end with some kind of job market opportunities for you to think about.
Great. Thank you, Dr. Olszewski.
Okay, so the nurse practitioner program, as Dr. Olszewski already had referred to, we do have 2 tracks. We have the adult gerontology primary care nurse practitioner, as well as the family nurse practitioner for folks that are interested in working with pediatrics. This has been a hybrid program, which means we did have classes on campus as well as online. However, all of the courses in this program are now going to be moving to online in the very near future. We have synchronous and asynchronous courses, which means some of the courses you just work through at your own pace. They're all online, but you work through at your own pace. You listen to recorded lectures, and then every week you're given the assignments and you just follow along. And but it's nice that you can, if you have to work ahead on assignments because you have other things going on, because we all have lives outside of school. We have work and so forth. So it does give you that flexibility, which is really nice. We also have the asynchronous online courses in which we would meet online a certain day of the week together and to go over the didactic work at that point, and then talk about clinicals and things like that. So just a little bit about the coursework. With the core courses, there's 27 credits for the core courses for the nurse practitioner program. With the gerontology primary care NP, the clinical courses, there are 21 credits, and this equates to about 720 clinical hours. And then with the family nurse practitioner clinical courses, it's 27 credits and then 920 clinical hours. And these clinical hours are, they exceed what the state requires for nurse practitioners, which is also a bonus. Our students do get a lot of clinical hands-on experiences. At the end of the program, there is a predictor exam that all the students take. This is going to help them to determine where they would need to focus for preparation for taking their national certification exam. And we do have the part-time and the full-time option, which again allows just for more flexibility depending on your work schedule, your life schedule. So we definitely have several different options for completion of the nurse practitioner degree.
Great. Thank you, Dr. Schaefer.
Sure.
Okay, here we have some, I'll share with you some information about the Masters in Public Health Nursing. We do have two different directions we can go with that. We've got the more traditional public health nursing track, and then we have options for those school nurses that might be out there, who already have their certification in school nursing here in Pennsylvania. And I'll talk a little bit more about what that means for those groups of nurses. Our program is available 100% online. We also work with you to whether you are able to do more of a full-time course sequence or part-time, depending on what's going on in your life and with work and family. And we understand the challenges that comes with all of that. So we could offer you, to work at your own pace when it comes to the course sequence. There is a clinical practicum component to whether you're completing the public health nursing portion or the school, whether you're a school nurse coming back to get your master's degree. So we work with you to complete that clinical practicum. It can happen in your community. So I think that's a big plus, and that's meaningful because that's where you're going to go back and work, and that's where you want to, focus your time and energy on, improving the health of populations where you live and work. So I think that's a big benefit to this program. As far as coursework goes, there are some differences here between the more traditional public health nursing masters. There are the core courses, which include things like epidemiology, community health nursing. There are 12 credits there that pretty much everyone completes. And then we give you some specialization in leadership and management coursework. There are a couple courses that we have you do there. The clinical courses for the public health nursing track are there's role development and health promotion with populations. Each of those is about 200 hours of clinical practicum time. And again, we work with you on finding appropriate places to do that in your community. For our certified school nurses, those core courses are just a little bit different. There are 18 credits there. And then we offer 2 courses that are really tailored toward enhancing our school nurse practice, and that's school nurse theory and a school nurse as educator. So those are courses that our school nurses take. Because they have their certification already, they complete one clinical practicum course, and that again, that's the health promotions with populations, and that's 200 hours of clinical time. Typically, those are offered over the summer because our school nurses are working all year long, just like everybody else. But we definitely work with you to meet your needs.
Great. Thank you, Dr. Barrett.
The MSN MBA dual degree option. This is a Master's of Science in Nursing and Nurse Administration. And then you can just do that degree, or if you would like to go on and do the MBA degree, you can do that as an option too. What I often tell students is it really is an efficient way to do this because it is only 5 more courses. So essentially like 1 more year and you can have the dual degree. So sometimes students will ask me, why should they have the dual degree? Well, the MBA is a much sought after degree in healthcare because healthcare, as you know, is a business. And in larger organizations, they are looking for leaders that have that MBA. However, if you're going to understand and lead a nursing team, unit, department, they want a nurse. And so for a nurse to come with a master's degree in nursing administration and an MBA really sets you apart as a uniquely educated and well-trained individual to handle those complex jobs. So I think this is what makes Bloomsburg University unique in that we have this MBA with this MBA option to it. And again, it's really 5 extra courses and you're having that second degree. So you have another credential behind your name. So what we do is we have 4 core courses that we take in nursing. They're all online, asynchronous, and that's what starts the degree for your MSN. And then you do a lot of your business courses kind of as the middle part of that. Now in your business classes, you have a lot of 6 weeks classes. So it allows you to expedite your coursework so you can more easily take 2 classes a semester because you will only be concentrating on 1 class at a time. If you do 1 class in the first 6 weeks of the semester and another class in the second 6 weeks of the semester, you actually end up at the end of the semester that you've completed 6 credits. And I mean, it is expedited. I'm not gonna make that sound like something it's not, but many of my students have found this to be, very doable with a busy work life and family life and those kinds of things. It's worked very well. Duly accredited with the leaders in accreditation for that. And much like the public health program that Dr. Barrett was talking about, we do have 2 6-credit practicums that culminate the degree. And so this is 180 hours each. And this is where you get to actually work on practicum projects within a healthcare organization and a preceptor guided by a faculty member, myself. And you can do this part-time or full-time, but it's a really unique program.
All right, great. Thank you, Dr. Metzger.
We have the doctoral program, the Doctor of Nursing Practice. And again, this is a postmaster's degree for our advanced practice nurses, whether it be our nurse practitioners, our CRNAs, nurse midwives, our certified nurse specialists. And it is 100% online. It's a 2-year program. And the required courses for this, they add up to a total of 33 credits. And they do include clinical hours, about 500 or 500 clinical hours, but these clinical hours are incorporated into the coursework and they tie into the project that's completed, an evidence-based project or a quality improvement project. And this project is something that is of interest to the student, usually ties into where they're working now, where they see themselves going. And for some students, this can be a little bit of a struggle coming up with the topic, but they think about it as they apply to the program. And sometimes it's useful to have some examples. Some of our students now are looking at things like comparing, incorporating the use of counseling for smoking cessation, incorporation with smoking cessation aids versus just smoking cessation aids by themselves, and how effective would that be? Or comparing things like the effectiveness of the American Diabetes Association type 2 diabetes risk test tool to just testing urine for sugar when you're trying to find out if truck drivers, for instance, might be at risk for type 2 diabetes. So things like that would be some good examples of studies that a student might come up with for this program.
Great. Thank you, Dr. Park.
Hi, I'm going to speak next on the BSN to DNP Nurse Anesthesia program. The program is a total of 101 credit and 36 months in length. We do have a requirement of 2,000 clinical hours. However, we well exceed this with our average of about 2,600 hours. There's a lot of highlights to our program, a lot of experiences students get to have going to state and regional meetings. It is a hybrid program. In the first year of core courses, they are online. However, once they arrive on Geisinger campus, it is all in person the last 2 years. So that part of the program, you are in person at Geisinger. All in-state clinical experiences. And like I mentioned before, all of our clinical sites are Geisinger sites. Dr. Ambrose, is there anything you'd like to add?
Kind of, as you can see on the slide, we're a busy program. The 26 or so hundred clinical hours you get is basically a full-time job. So you don't work during our program. You're rather busy, and we do a lot of advocacy work in our program. As you can see, we have a lot of state and national meetings to go to. Myself and Dr. Manzola will be at our state meeting this weekend speaking, so that there's a lot of opportunities for our students to present and to get in front of a professional audience and really network and get yourself out there.
Great, thank you, thank you. So I said a couple quick follow-up questions before we move on. First question would be, what is the typical time commitment, right? So I know just about all of our prospective students, with a few exceptions, would still be working while pursuing one of the advanced degrees that we would offer here at Bloomsburg. What can the typical time commitment look like when class is in session or school is in session?
In the nurse anesthesia program, students cannot work. The first year during the hybrid portion where the courses are online, they can continue to work. However, when they arrive on Geisinger campus, it is over 40-hour a week of either didactic or clinical education. So that has to be taken into consideration when you're thinking about the path of anesthesia.
Sure, great, thank you.
I mean, I
I'm
can
gonna
speak
answer.
to,
Oh,
Oh.
go ahead.
I was
We're
just
just
going to
gonna
speak to
talk
the nurse
about the,
practitioner program. Sorry, Cheryl. The nurse practitioner program can be done in a full-time or a part-time scenario. And with that, it depends on how heavy the course load is. So, the adult gerontology program can be completed as quickly as 2 years. And we have students sometimes that need to take it a little bit slower, and they may take up to 4 years. So we can customize, I guess, based on life needs, because things happen with adult learners. We know that. But it fluctuates. And again, we're adaptable to the students' needs to make sure that they're not overwhelmed while they're in the program and they're successful. And, we tell our students, it's like they do in anesthesia, if you're working full-time, it's really difficult to try and do our program full-time. We want you to be successful in all areas. So, and that's just the nurse practitioner program. I mean, again, each program is a little bit different. And again, most of us and all of us are able to customize, and fluctuate and be flexible to meet the students' needs.
Great, thank you, Dr. Olszewski. And Dr. Jackson, do you have something to add?
The only thing I wanted to add was to talk about the clinical hours a little bit. So once students get to the clinical portion, if they're only doing the clinical portion, they have one night of class, which is, like a 3.5 hour evening of class. And then they have a day of clinical. So we're going to say the day is anywhere from 8 to 12 hours in order to get your 200 hours in over the time of a semester. So it's quite a chunk of time, considering adding those clinical hours in with the class time.
Okay, great, thank you. Anybody else? With the time commitment. Okay. So again, another follow-up question is, if we had prospective students who were thinking that, what, I'm not a computer whiz, I don't have a degree in computer science, and I see some of the programs are offered online or they're offered through a hybrid modality. What's the expectation of a technical knowledge in order for a student to be able to successfully complete or participate in these programs? Or is it as simple as just being familiar with Zoom, which if you're watching this recording, my guess is you probably are familiar with Zoom and YouTube and some of the other social media channels out there.
I can speak to the learning platform if you'd like me to. So
Yes, that'd be
as
great.
part of the technology, because it goes across all of the programs here.
Mhm.
So we do have a Desire to Learn is our learning management system that we use. We call it BOLT here at Bloomsburg University for right now. But it really is fairly easy to learn. And I say that as I'm not a high-tech person, so I'm able to manage BOLT on the faculty side. But I think that it's a very easy one to learn. Zoom is built within that. And so this is where you can gain all of your content, your discussion boards, your grade book, your class list, any assignments where you drop, and upload your assignments or whatever. But it really does guide you through, and it's pretty easy to adapt to. But the other benefit is that you have a 24/7 hotline, if you will, into Desire to Learn that supports you through Monday through Friday during the week. You also have a local, what we call Media Design Center, Instructional Media Design Center, that is here that can help guide you through those kinds of things. And that's in addition to the library and the support services that are there. You can actually log on and chat with a librarian just as you're searching things or whatever. So I think there's a lot of resources and support around you to guide you through the technology if that's something that is really kind of holding you back. For the CRNA program, they have access to Geisinger resources, another medical library. So I just think there's a lot of resources around you that you can tap into that will help guide you through technology. So I would say, don't let technology hold you back on that.
Okay. And just to clarify then, basically all you would need is just a laptop or access to a computer. I think that it's safe to say. Okay, all right, great. And then final question. So again, for most programs, not all, but for most, people will be working while completing the degree. What is the level of flexibility like? If you miss a class or you have a shift that gets changed or something comes up, what's the degree of flexibility for most of the programs?
I guess I can take that one again. I spoke to flexibility a little bit as far as course sequencing and course scheduling. But, when you make the commitment to come into a graduate nursing program, I mean, we really expect the synchronous learning to be synchronous and to be, try to be, we have an attendance policy because we cover a lot of information in 3 hours a week.
Mhm.
So there are situations where things happen and we record a lecture, but by and large, the synchronous learning from an online perspective, we really do make it mandatory that you be part of that. That said, we understand life happens, work happens, and we try to have a degree of flexibility. The nursing anesthesia program, and maybe Dr. Minzola or Dr. Ambrose can talk about that, about how that works, because that's a very intense program with the amount of clinical hours and how that looks. So maybe they want to add a little bit more to talk about their program.
Sure. Thank you, Dr. Olszewski. As Dr. Minzola had mentioned, our beginning of our program is hybrid with our core courses on the university. So at that point, you can work, and we do have some flexibility in the courses, but it's a 36-month program. So about the last 24 to 26 months of the program, you're ours. You're at Geisinger campus, and you basically have a full-time job. We spend minimum 40 to sometimes 50, close to 60, I think is our cap, hours a week between class, clinical, and on top of that, there's a lot of OR prep and a lot of study time. It's a rather intensive program. We do understand life happens. As anytime you get into a graduate program, life happens, and we always say the worst things happen at the most inopportune time. So we can be flexible enough to get you to your family for emergencies and for important events, but by and large, we're your full-time plus overtime employer.
Sure. Great, thank you. I appreciate that. So then moving on, so this is a big commitment. It's a huge undertaking. what's the best reason, I guess, or what are the best reasons for pursuing the MSN or the DNP programs? Obviously, again, it's going to be, this is a big investment of time and labor. Why would a prospective student say, you know what, no, I think this is a program for me. I think I need to complete this.
I think one of the main reasons is when you go back to school, your goal is to expand your knowledge. So advancing your scope of practice, more autonomy in your role is one of a main reason to do this.
Mm-hmm. No, sorry, go ahead, Dr. Barrett.
Well, yeah, I was just saying from my perspective with, having got my master's degree and moved on in these types of programs, is that it really expands your job opportunities and your ability to, whether you want a leadership position or you want an advanced, clinical practice position, or just want to work with different populations. I think this is a great way to go, whether it's a master's degree or the DNP.
Now, is an advanced degree like an MSN or the DNP, is that a minimum expectation in order to get into a management level position, or is that basically, is that an expectation at this point?
If you're talking about a management position, I think that it is an expectation of a master's degree. And that's why I was speaking about the MBA. There may be some nuances where it's not clearly stated that they have to have an advanced degree, but for the majority, once you move out of like a frontline management position or first step management position, those other ones are going to have expectations of higher credentials, and widening that knowledge base that you have in order to practice, understanding budgets and finance and marketing and those kinds of things. So it will be the expectation from my perspective anyway in management when you move on. Certainly it is for practice. Absolutely.
Sure. Sure. Great. Thank you. And then what are some of the professional experiences that would be built into the curriculum? I think this is one of the things that we do really well at Bloomsburg is basically a lot of these things, they're already embedded in the curriculum, right? So a lot of this, like we kind of already have the plan laid out. We have a plan for your career development, and we have a plan for these types of things. But can anyone expand on some of the experiences that an incoming student might engage in while enrolled in any of the programs?
Well, if you don't mind, I think I'll lead this one off because this is a group of my students with our current state representative doing some advocacy lobby work for our profession. So, I could speak on the anesthesia end. We do an awful lot of work. Anesthesia is a rather politically driven profession. So we spend a lot of time with our state legislators, with our national legislators. I got back not too long ago from DC. We were down there at the Capitol doing our advocacy and lobby work. These are expectations, minimum expectations of the student. Like I said, we have our state meeting coming up where we'll be doing a lot of networking kind of work. We spend time at our state capitol, letter writing, we cover the gamut of patient advocacy, because at the head of the bed, we're still in charge of our patient, all the way through to the political professional advocacy. So there's a vast array of professional opportunities to get your feet wet at.
Great, thank you. Anybody else? Can anyone else speak to the clinical experiences that might be embedded into a program?
As far as the nurse practitioner program goes, again, it would depend on the track that you are interested in, whether that be adult gerontology or family nurse practitioner. But we do encourage students to get as many experiences as they can while they're in school, because once they get out and they start practicing in a primary care setting, then they're going to be treating all types of conditions all across the gamut. So of course we have specialists, but in primary care, you may be the specialist for that period of time. We have students in pediatrics, we have students in women's health. They're caring for pregnant women if they're in the family nurse practitioner role. Also, we have students, going to nursing homes, occupational medicine clinics. We also do allow just some observational experiences. If there's a specialty that a student may be interested in when they get done with their schooling, whether that be cardiology or, you know, pulmonology, sleep medicine, you know, just as long as it's an outpatient or a primary care type of role, you know, we do certainly encourage our students to get those experiences as well. So we have a very diverse, you know, clinical experience.
Great. Thank you, Dr. Schaefer. Anybody else? Okay, and then possible career paths. And you can see here a list of different titles. I think nearly all of these are modeled after some Bloomsburg alums. But can anyone talk about, you know, the different career options that might be unlocked by completing one of these graduate programs?
I don't mind talking about the MSN and MBA option, although I think I want to preface that by speaking to the leadership and management abilities of a nurse, period. So I think we all, no matter where we started our education as nurses, that, you know, to be a leader or a manager in nurse, even at the bedside, is something that's embedded in our profession. And so I think nurses are leaders and managers right where they are in many places. But once you go on to earn some of these additional credentials, it certainly can place you in the environment where you can really have influence over healthcare organization, how healthcare is determined, what it looks like in future practice settings and those kinds of things. So I know for the MSN MBA, I've had students in higher education go on to assistant and associate dean positions and then go on in more legislative roles. I've had students work from an operations manager up to AVPs in hospitals where they become associate vice presidents. And certainly people who have gone on to get the MBA and that kind of thing work their way as chief nursing executives into the C-suite, chief nursing officer, chief nursing executive, and it can go even in specific areas of, you know, specialization for that kind of thing too. I'll let other folks talk about those kinds of things that are listed there. I'm at the top of the list maybe there on that one, but I'll let other folks chime in about the other roles that we have here and what they can do for you.
I'll add that probably each of us on this phone call have been in different career paths. Oops, sorry. I said, I believe each of us on this call probably have a story to say on when we started out in nursing. We didn't think we'd end up where we are today because nursing can take you down so many different paths. It's incredible. If you would have asked me when I started my nursing career, if I'd be teaching, I probably would have told you, no, emphatically, I did not see myself there, but that's where you end up. Having that advanced practice degree, I think opens up a tremendous amount of doors. You know, it may take you down a path you didn't think about exploring, but a clinical experience touched you and took you down that path. So I believe our program, we try and give you as many experiences as possible and introduce you to these roles of being an advocate in Washington, D.C., or, you know, being an entrepreneur and starting your own business and hanging your own shingle. We all have those experiences that we can relay back to the student. And I love hearing the stories when students apply to our program on what they aspire to do. And half the time they come out of our program with a different goal because something touched them and made them change that path. So I don't know. I just, there's so much opportunity. And again, we all have different stories, and it's incredible where our graduates go to work and what they do. It really is.
Yep, thank you. And then just some final highlights here that we haven't yet covered.
I guess I can take this slide as well. As I mentioned, our graduate programs have been around a little over 30 years. All of our programs here at BU are CCNE fully accredited programs. We, as far as like our pass rates for, and specifically, we're going to talk about the nurse practitioner pass rates and the nurse anesthesia pass rates. The nurse practitioner pass rates, we're at 100% for both programs. And we feel very strongly that our curriculum will get you to passing those national boards upon completion of this program. So we're very proud of that. And again, our programs are accredited. The CRNA program is accredited through a different body called the COA. the Council on Accreditation, and they're fully accredited as well. It's just because of the nature of their practice that they have a different accrediting body. Again, we talked about clinical experiences. You know, the CRNA program uses Geisinger facilities all over. Geisinger is such a large entity and they have vast experiences there. Our nurse practitioners, we encourage them to seek out clinical experiences near where they live. We help them identify places, and they've worked in clinics, they've worked in mobile units, they've worked in community clinics. Just, you know, whatever their passion might be, we help them find that passion. So we do use an extensive network outside of Geisinger for the nurse practitioner. The public health nursing, Dr. Barrett can speak to that. They utilize a wide variety of resources in the public as well. And really, if someone comes to us with an idea that we haven't explored yet, we're going to help you find that answer. So we're really proud of the partnerships that we've created with other agencies throughout the Commonwealth. And again, our nurse practitioner program, that pass rate, we're very proud of that. We like to keep in touch with all of our nurse practitioners after they graduate, as all of our alums, to hear where they're at and what they're doing. And our program participants will tell you that in any of our graduate programs, it's word of mouth that really helps us grow these programs, because they sing the praises of Bloomsburg, and we're very proud of that.
Yeah, this is, you mean, the nursing programs at Bloomsburg. I mean, this is our banner program. You know, you could say that, you know, we might not do anything better than we do nursing. I know that's not, you know, perfect English, but this is a banner program that puts us on the map for people across the country. Especially, I think we've expanded options for students, because the programs are online or they're hybrid, and you know, a lot of our programs are, you know, they're flexible. You know, we try to work around what you have going on, and you know, the fact that this is, you know, such a reputable program, I think you have a lot working for you as a prospective student. Yep, thank you.
Mm-hmm.
Job outlook, probably the slide that people are most interested in, thinking, if I'm going to put all this time and effort into this degree, what am I going to get out of it?
All right, let's walk through the disciplines. Dr. Schaefer, what's your prediction for the nurse practitioner program?
Well, I can say that I can't imagine there's any nurse practitioner that would graduate from our program and not be able to find a job. It is predicted through the Association of American Colleges of Physicians that there is going to be anywhere from a 40,000 to 120,000 per physician provider shortage. So nurse practitioners are filling that role very well in primary care. So, you know, we really are making our mark, and we have a big future ahead of us.
Dr. Barrett, what's going on in the public health sector?
There's lots going on in public health. Don't we all know that? We've been, you know, living and breathing this pandemic for so long, and not that I think that's a good thing, but it really has highlighted the shortage of really qualified public health nurses that are out there. Has really, if you watch the news, I always tell my students, if you climb out from under that nursing rock that you're living under and you watch the news, you're going to hear those words that we talk about in public health right in front of you. So there has been a growth in you know, the need for public health nurses. So we do work with our students who, you know, work with the Department of Health here in Pennsylvania. We've had nurses move into you know, leadership positions based on having their master's in public health nursing. They may already have a job, but they're looking to move into more of a leadership position. We do care for populations, so that's why there are opportunities in schools, community clinics, even in occupational health, if you're looking to manage, you know, the health of populations. And again, the pandemic really turned a lot of our nurses out there into public health nurses. Our school nurses and our occupational health nurses, and even our nurses in hospitals, are conducting surveillance and contact tracing, and they got a quick study on you know, epidemiology and how to manage the health of populations. So and I was just reading today that the expected growth in jobs for public health nurses is going to grow up through the next, I think I read 7 to 10 years, like 7% per year. There's a lot of growth out there and job opportunities available. So thank you.
Certainly the pandemic has brought you great visibility to that whole role, unfortunately.
Yes, unfortunately.
Dr. Ambrose and Dr. Manzola, nursing anesthesia program.
I don't have the numbers quite in front of me, but there's always been a shortage of anesthesia providers, and it is continuing as we see. We have 100% job placement of our students, low attrition rate of our program. And like we spoke before, we are such a flexible program that we're really family oriented at our program, but the possibilities are endless. And I think Dr. Ambrose could add to my statement.
Our job outlook should look like that World War II poster with Uncle Sam pointing saying, "I want you." We are short nationally in anesthetists, and
Right.
we've expanded our practice greatly. So our CRNA job outlook is excellent. We need people at the head of the bed. We need people in the C-suite, but our CRNAs nationally are going on to pain management practices, ketamine clinics, all those sort of things, hanging their own shingle, independent practice, running their own practice. So sort of with us, the sky's the limit, and we want to pack them in. So nationally, we need your help.
Dr. Ambrose, I see a billboard in your future with you, doing the pointing with the top hat on. We want you, got the
It'll cover the bald spot. I
I like
could take
that.
Yeah. Right.
All right, Dr. Metzger, MSN MBA.
Well, the sky is the limit, I think, because, the MSN MBA has that entrepreneurial spirit built into it too. And I just think that right now is such an exciting time for nursing. You are 4 million strong in this country. And so I think that all that Dr. Barrett has said with the pandemic has brought nurses to the forefront more so than we've been in the past. And I think that's a very exciting time to show society, to show the public what nurses really are, who we are, and what we do in all sorts of roles. And I think with MSMBA, you can be a nurse leader, you can be a nurse manager, there's no limit to what you can manage or lead, but there's also the entrepreneurial suite, as we said, the entrepreneurial idea of what you can do with that as well. But it's, I think really the sky's the limit. That sounds kind of big and like a big dream, but really, there's really nothing to hold you back. And if you ever want to teach, just let us know.
And speaking of terminal degrees, Dr. Park, thoughts on the DNP?
I think the DNP is very helpful for exactly people who want to teach. There's always a need there, and the doctoral degree is necessary for that. Your advanced practitioners in the clinic or hospital setting, the DNP is helpful if they want to move on to a managerial position. So there's always a need for the DNP as well.
And Dr. Jackson, will let you comment on all the above. What's your thoughts on the outlook for advanced practice nursing?
I think that one of the things that I feel strongly about is that as nurses, we're lifelong learners. We just are. We're always learning. There's always something new. Medicine and caring for people is not a stagnant thing. And so going back to school to learn is always beneficial. So definitely a beneficial role. I see the role or the educational needs expanding as well for entry level into roles, just to be on par with other professionals, other professionals that have doctoral level as their entry into practice. And so I think that's where the DNP is going to be very important in the future. And it's always fun to learn. So.
Absolutely. Great. Thank you, Dr. Jackson. And then finally, the admission part. And you can see that the application process is fairly painless, is probably the best word I would use to describe this. The online application probably won't take more than 10 minutes. Rolling admission, which means that we accept applications for both the fall and spring, and also the summer semesters as well, with the exception of the CRNA program. So again, we're open for business year round. We do not require GRE scores as part of the admission requirements. I know that's among the most common questions we get is, do I have to take GRE? You do not. We do require the college transcripts. And then there are going to be specific undergrad course requirements that you would have needed to have completed as part of your bachelor's degree. Now, I will say each individual program is going to have more nuanced admission requirements that you would be able to find on each departmental website. So that might be something to take a look at if you get the chance as you're prepping for the application process. But in general, the application process is going to be fairly painless. So this should not be a barrier to entry for you by any means. And same would go if you're looking for information, because each one of these programs is so specialized. That's why there's a big group of us here tonight. If you have questions or you're looking for some additional information, please feel free to visit our nursing website, where you'll see a complete faculty listing and along with everyone's contact information. And I think it's important to keep in mind that we work for you, right? And we're happy to do that. So if you have any questions, please feel free to direct them to the program coordinator for each of the individual nursing programs that are represented here tonight. We love to hear from prospective students. We look forward to hearing from everybody here in the future. That kind of concludes the event for tonight. So for anyone who's catching the recording, we appreciate you tuning in. We look forward to hearing from you in the future. And go Huskies. Thank you, everybody.